Hello there. Today we are going to discuss about the white blood cell parameter on the CBC. You might be there, you've gone to the hospital and they've given you this kind of set of results and you don't understand why is the white blood cell count high, why is the red blood cell count high or low, or what's wrong with the platelets. Or you may be a medical profession and you want to get a grip on the understanding of these parameters, or you could be a student preparing for your exam. So please, if you find sense in this video, make sure you subscribe and support us so that we can bring more useful stuff like this. You can support us by giving us a like. You can follow us, you can comment and tell us which other topic you would wish us to tackle. But today, let us handle this and make sure we make it easy for each and every person who is listening. Alright, now we need to understand that when we are clocking our patients, these are the factors we consider, especially when we go and get a blood work of a patient. We get some of these samples and yes, let's dig right into it. As we are discussing these parameters, we are going to be discussing a specific parameter on the CBC. We are going to be giving an overview. We are going to see the causes and the implication of different scenarios. For example, when you get CBC having increased white blood cell, what does it imply? And when it is low white blood cell count, what does it imply? So stick with me as we explore these results. Alright, now a CBC in full, this is what we call a complete blood count. This is just a set of tests that provides information about the cells in a person's blood. It can reflect acute or chronic infection, it can reflect allergies or problems with clotting, among others. Now, there are different types of parameters on a CBC, but perhaps today let us start with the white blood cell parameter. Most times when some medics or some interns see the white blood cell count is high, they run straight on prescribing what? Antibiotics. But there are different factors that can lead to an increase in the white blood cell count. And there are 5 types of white blood cell. This is what we call the white blood cells are called the leukocytes. There is the granulocytes. These are also called the myeloid cells or the polymorphs, subdivided into the neutrophils, which are further divided into the bands and the segs. We also have the eosinophils. These are followed by the basophils. The other classes, we have the mononuclear leukocytes, which are divided into the lymphocytes and the monocytes. Now, any of these cells could contribute to the increased number of white blood cells depending on the factor we are dealing with, as we're going to see in the future. So what is the normal range of these white blood cells? Yes, of course, we've been here talking about increase in white blood cell, but what is the normal range? Of course, definitely we have the range is 4.5 to 11 billion cells per liter of blood. That is 4.5 to 11 times 10 to the power 9 per liter of blood. Now, depending on the symptoms the patient is presenting with or the different factors that are into play, there could be causes of an increased white blood cell count that is above 11 billion cells per liter, or it could be a decreased white blood cell count. If the white blood cell count is above 11 billion cells per liter of blood, this is referred to as leukocytosis, and it can be classified according to the component of the white blood cell that has contributed to this increase in the total. For example, we could have neutrophilia. This is a condition characterized by a high neutrophil count. Other conditions could be contributed by other blood cell count, as we're going to be seeing. For example, the lymphocyte count could also increase, leading to a condition known as lymphocytosis. Now, the monocyte count could also increase, leading to what we call monocytosis, and the eosinophilic count could also increase, leading to what we call the eosinophilic leukocytosis or eosinophilia. The basophilic granulocyte count could also be the cause, leading to basophilia. And sometimes it could just be mature cells. This is what we call the blast or a combination of the above. In the next a few minutes, we shall be seeing what we call the left shift, where immature cells are involved or they are released from the marrow storage pool. Let's discuss some causes of this leukocytosis. There are many factors into play. Sometimes we misinterpret this and we think it's just an infection, but there are several factors. Let's start with steroids. Now, steroids, this one mainly affect the neutrophils. Now, in order to understand this, you need to understand that the neutrophils, they adhere on the blood vessel walls, and here they can move by pseudopodium movements and squeeze in between cells, enter into tissue so that they can engulf what we call the bacteria or an infection. Bacteria, the fungal, they can just, that's how they protect us from the disease. Now here, the steroids, what they do in patients who are taking, let me say, high doses of the steroids, or sometimes people with Cushing syndrome, as we shall be discussing this condition later videos. These corticosteroids or the cortisol levels, they inhibit the neutrophils from attaching or adhering onto the blood vessel wall. So this means that when you take a blood work or take a blood sample from this or such a patient, you'll see that the neutrophil count is high. This is what we call demargination, and it takes about 60% of the steroidal effects. Steroids could also increase mobilization from the bone marrow storage of these neutrophils. They can also reduce migration into tissue. As I told you, these neutrophils, they can squeeze through cells, enter into tissue, and they can engulf these microorganisms or the bacteria or the fungi. Now, other causes of increased white blood cell count, of course, we have what we call the infection. Now, these infections, they are different types of infections, the bacteria, the viral, the fungal. But of course, what you have to understand is that some infections can lead to low white blood cell count, while others can. For example, Clostridium difficile can lead to an increase in white blood cell count, but typhoid can lead to a low white blood cell count. Viral infections can lead to a low white blood cell count. So make sure you do other differentials. You make sure you find out more about the clinical symptoms of the patient. For example, you ensure the patient has signs of sepsis before you prescribe your antibiotic. So these signs may be including feeling dizzy or fainting, changing in the mental state, diarrhea, nausea and vomiting, slurred speech, fever, sweatiness, shortness of breath. We have malaise. We have, of course, these ones, you have to be seeing them, chills. So as a medical profession, you have to be ensuring that you find the differential diagnosis. For example, some conditions are shared. If a patient presents with fever, you have to rule out flu, you have to rule out malaria, and find out the signs of sepsis or the signs of bacterial infections. And if they are all matching, then you can go ahead to prescribe your antimalarial, your antibiotic, or sometimes some antihistamines. Other causes, we have inflammation. This can also trigger an increase in the white blood cell count as a result of the inflammatory cascade. Then we do have other causes such as allergic reactions. These can also trigger an increase in the white blood cell count. Other causes, we have malignancy in leukemia. This increases the number of immature cells in the blood system. Sometimes it could also be just hereditary condition or any other miscellaneous causes. Now, say you receive a CBC. What should you do when interpreting it? What exactly would you be looking at? What do you consider? Now, in order to interpret the CBC, you have to be considering, one, what are the clinical features this patient is presenting with. As I told you, we need to assess signs of infection, signs of sepsis. For example, we need to see if this patient has malaise, this patient has chills, or even fever. But these conditions can also be seen in leukopenia. We have the duration of these symptoms. Have they just started? Have they been there for quite some time? And also the remainder of the CBC could help us to interpret more and also clock this patient very well. Now, in most cases, treatment for leukocytosis is not even necessary, but in extreme cases, for example, in conditions such as acute leukemia, that is hyperleukocytosis syndrome, leukapheresis, hydration, or urine alkalization could be employed to facilitate uric acid excretion. Leukapheresis is just a process to treat chronic lymphocytic leukemia or a patient with a very high white blood cell count. Here, the blood is passed through a machine that takes out the white blood cell and returns all other blood cells in the plasma back into the bloodstream. Now, hemoconcentration and dehydration can lead to an increase in total number of white blood cells. Therefore, we have to hydrate this patient, as we shall find out further that increase in uric acid concentration, for example, in people with gout, can also trigger an increase in the white blood cell count. As I said, different components of the white blood cell could trigger an increase in the number of white blood cells. For example, the basophil leukocytosis could occur when the basophils are greater than 0.1 billion cells per liter, and this is caused by an allergic reaction mediated by immunoglobulin E. Monocytosis can occur when the monocytes are greater than 0.8 billion cells. Common causes include chronic infections. We have bacterial endocarditis, rickettsiosis, malaria, collagen fiber disease, and also inflammatory bowel disease. Now, the neutrophilic leukocytosis can occur when the neutrophils are greater than 7.5 times 10 to the power 9 cells per liter, and the common causes here we have acute bacterial infections, sterile inflammatory tissue necrosis. We could have burns, crash injuries. The eosinophilic leukocytosis occurs when the eosinophils are greater than 0.4 times 10 to the power 9 liter per liter of blood. And the common causes, we have allergic disorders, we have parasites, we have the drug reactions. What you need to understand, the lymphocytosis, it occurs in line with the monocytosis. So when we have chronic infections such as tuberculosis, bacterial endocarditis, rickettsiosis, malaria, collagen fiber disease, or inflammatory bowel disease, this can also in turn trigger an increase in the lymphocytes. Viral infections such as hepatitis A, cytomegalovirus, Epstein-Barr virus could also trigger an increase in the lymphocyte count. Sometimes the white blood cells could be low, leading to a condition called leukopenia. It simply means a decrease in white blood cell, and the supply may be depleted due to an infection such as typhoid, or it could be treatment with chemotherapy, radiation therapy, or when the hematopoietic stem cells abnormality does not allow normal growth, maturation within the bone marrow, such as in myelodysplastic syndrome, or what we call leukemia. Leukopenia is most often due to a low number of neutrophils. This is referred to as neutropenia. That means the cells are less than 1.5 billion cells per liter of blood. So mainly it affects the neutrophil count, and sometimes we have there is a transient reduction in the neutrophil in the blood. It can occur due to the cytokines being produced in early viral infections, where there is continued reduction in the number of but however, this implies that the demand is greater than the supply, and this can also arise either from increased utilization or disruption of bone marrow production. Sometimes in severe infections, the blood count may fall as reservoir granulocytes are being drained faster than the production can replace them, and in these circumstances, immature granulocyte precursors such as the band forms, the metamyelocytes, the myelocytes may be mobilized to enter circulation. This is what we call the left shift. And the low neutrophil count can be a blood count finding in overwhelming or severe sepsis, especially if there is a left shift. So the left shift, you see the bands being proliferating into segs, or sometimes increase the number of band cells. Now, in summary, you can feel free to pause this video so that you can read through all this. So the neutrophils, they could be associated with infections such as bacteria and fungi. The lymphocytes associated with chronic infections and viral infections. The monocytes could be associated with chronic infections. The eosinophils are associated with allergic reaction, parasitic infections. The basophils are associated with allergic reactions. The blast crisis in chronic myeloid leukemia. Immature granulocytes are associated with infections, growth factor therapy, chronic leukemia, acute leukemia, commonly referred to as the left shift. So yes, of course, you could pass through this, but what are the implications when you receive a CBC? What do you take of it? Definitely, for example, when you receive a CBC having high white blood cells or even having low white blood cells, as the medical profession, you should consider if the patient is under any acute stress. We know stress can trigger an increase in cortisol levels, so we need to be vigilant of this. Is the patient having an infection? Of course, you have to assess signs of infections, as we talked about, malaise, fever, and chills. Is the patient having gout, rheumatoid arthritis? All these are conditions that can increase in the number of white blood cells. We have what we call thyroiditis, we have trauma, and sometimes pregnancy. Actually, in pregnancy, there is increased white blood cell count. Now, if the patient is having a low white blood cell count, what should you think of? You should definitely think of either anemia. For example, the patient could be having an acute blood loss or chronic blood loss. For those who have ulcers, we have a patient having severe infections, as you remember, and sometimes in some viral infections, typhoid can also trigger a low white blood cell count. Of course, the patient could be on chemotherapy. These mainly affect the bone marrow, leading to pancytopenia, and sometimes the viral infections I talked about, yes, they can also trigger this. So as medics, we need to put this in consideration, that will help our patients and not just prescribe antibiotics because they are in our reach. Yes, if you find this video interesting, if it has triggered you somehow positively, if you've benefited, you please ensure you subscribe, you comment on what you think we should be adding, on how we should be presenting. You could share this video with your friends. You could tell us more of what you really wish to be finding. You give us a like, you follow, you comment, you give us a thumbs up, and share this to your friends, please. Let us learn together. Bye bye.